welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton. I'm a maternity pediatric chiropractor, functional medicine practitioner, and mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. And today I have the honor and privilege of having Dr. Marty Rosen back for round 2 on Well-Adjusted Mama, and this time joined by his lovely wife, Dr. Nancy Watson, to talk about the topic of helping parents decode infant development, and specifically how that relates to cranial alignment and the nervous system. Dr. Martin Rosen is an internationally renowned chiropractor, educator, and author with over 4 decades of experience in SOT Chiropractic, Pediatrics, Cranial Adjusting, Chiropractic Philosophy, and Practice Management. Summa cum laude graduate of Life Chiropractic College in 1981, Dr. Rosen has dedicated his career to mastering the art and science of chiropractic and sharing his clinical expertise with practitioners and students around the world. Since 1982, Dr. Rosen has maintained a thriving, family-oriented, neurologically based chiropractic practice in Wellesley, Massachusetts. Known for his authentic approach and unwavering commitment to excellence, he has earned a long-standing reputation for outstanding patient-centered care. His deep dedication to advancing chiropractic led him to begin teaching in 1979, and since then he has educated thousands of chiropractors, healthcare professionals, and students through seminars, online courses, research publications, guest lectures, and hands-on workshops. As an accomplished author, Dr. Rosen has written and contributed to numerous texts and publications, including Pediatric Chiropractic Care, the Pediatric SOT Spinal and Cranial Adjusting Manuals, the Pediatric Participant Guide for SOT, and multiple chapters on SOT in those second and third editions of Chiropractic Pediatrics. His work has also been featured in a wide range of articles, podcasts, and published research papers. Together with his wife, Dr. Nancy Watson, Dr. Rosen co-founded the Peak Potential Institute, offering premier educational programs and tools for chiropractors, healthcare providers, and parents. Their most recent book, second edition, It's All in the Head, brings awareness to early childhood developmental challenges and empowers parents to recognize and respond to potential concerns before they become entrenched. Through books, seminars, interviews, and video-based instruction, Peak Potential Institute offers a comprehensive platform to support healthcare education and elevate pediatric care. As parents of 2 daughters and partners in both life and work, Drs. Rosen and Watson have combined their 80-plus years of clinical teaching and parenting experience to deliver a unique perspective that blends science, philosophy, and heart. Their mission is to elevate chiropractic care and educate professionals and families with knowledge, insight, and practical tools for optimal health. Well, hello. Welcome to the show. It's so great to have you back on.
Yes, thank you for having us.
Yeah, it's great to see you again, Laura, and to be on your show. We really appreciate it.
Yeah, of course. And I think last time it was just Marty and me, so I'm really happy that Nancy was able to join us this time. So last time we talked, a year ago, was about your book, It's All in the Head, and it was your first edition, and now you recently had the second edition come out with some updates and edits. So I'd love for you to share with the audience a little bit about your book and what you're here to share.
Yeah, well, thank you for the opportunity to do this. And when we first wrote the book, and it's actually been a little more than a year, it's probably been about almost 2.5 years. We wrote this book because we found that there were so many things happening at that time where people were accepting what was common to be normal. So we really laid out the book with the purpose of letting parents know and become informed of what they should look for in that first 2 years of life. What are the normal milestones? What are the normal growth patterns of the brain? And how important it is. And what we left out of the book, which is why we wrote the second edition, is like we gave them a boat, but we didn't give them oars. We didn't give them action steps of what they could do with this information. So we know how powerful it is for people to have information, especially parents. They're looking for information. They're looking for what to do with their child. Every parent wants to do what's best for their child. So the second edition, we give some checklists about what to look for and then what to do about it.
Yeah, we think it's really important. And one of the feedbacks we got from the other book is, okay, now I see this, now I know this, so where do I go with it? But it's also so important in those first 2 years of life to get signs of these neurodevelopmental disorders so that issues don't occur later in life. That's what we find to be such a problem and so sad is we'll talk to parents with 3, 4, or 5-year-olds that the kid now has some kind of diagnosis, whether it being on the spectrum, whether it be dyslexia, ADHD, whatever the name is that they give it. And the parent, usually the mom, has known before that there was some glitch in my child. Like, I knew this before 18 months. I knew it. And, the sadness is in most of the medical profession won't make the diagnosis until there's enough checklist of the symptoms that they can give it a name. But when parents realize that there is dysfunction or decreased optimal potential, they want to have a place to go and they want to know what to do with it. And that is the time to really make those changes in those first 2 years of life when the brain is growing so fast.
That is so true. And I think I agree with you. I see it so often in my practice. The moms come in, they're like, I saw something, baby was 3 months, 4, 5, 6 months, under a year old. There was something off, especially if it's a second or third time mom, right? And they can compare it to their older children. And they talk to the pediatrician about it and they mention it and it gets dismissed. Oh, they'll outgrow it, oh, don't worry about it. And because it hasn't hit that threshold yet for a diagnosis. But the diagnosis then comes later and it's harder to treat, like you're mentioning, if it's later than earlier. Do you want to talk a little bit, like you mentioned, the brain development, like why the first 2 years is more important than if later on?
So first 2 years of life, the brain itself is going to double in size. It's going to grow 101%. All of the tissues in the brain, what's called, the gray and white matter that we talk about, 80 to 90% laid down first 2 years of life. The connections, the synapses, how the brain communicates with itself, the peak development that is in the first 8 months of life outside of it. So what you're talking about is a brain that's never going to grow this fast, is never going to have this much input. By the second year of life, the brain's going to grow 15% more. And the biggest thing that's happening is the main processing center. If you want to kind of make the brain like a computer, the main processing center, which is the cerebellum, is going to increase 240% in the first year. So basically what you're doing when the baby's born, they have all these mechanics in them, like buying a computer. And now what we're doing with the computer is we're putting in all the software and the ability of the computer, the RAM, and all that, the ability for that child to work for the rest of their life at an optimal potential. So if there's damage, just like if you buy a computer that doesn't have enough RAM or that doesn't have enough graphics cards, when you start to use more software in it, the computer breaks down. And that's why, like you just said, we often see that kids come in at age 3 or 4 years old because now they're asked to perform at higher levels. They're in school, they're in preschool. And because their brain has a glitch in it that maybe the mom noticed or the pediatrician sloughed off as all they'll outgrow it, they now have a harder time adapting and the thresholds are lower, so they can't adapt to those major inputs. It's like having a Mac, putting too much stuff in it and you get that little wheel spinning. That's what happens to these kids' brains. That little wheel spins, they stop, they can't process that information.
Wheel of death.
Yeah, so the first 2 years of life is when you're laying down, you're building that city, you're building that foundation, and that's why it's so important.
And there are signs along the way if there are glitches, and you can notice, and that's what we talk about in this book. Are you on the track of your nervous system being laid down properly? Is the brain growing at the best optimal way? And outside signs, whether it be primitive reflexes or your milestones or cranial distortions, those will show up as well. So those, we can see those right from birth, and being able to recognize them and know what you're looking for and knowing whether it's normal or if it's not normal, that's a very important part as being a parent. Every parent wants to do what's best for their child. Every parent wants to give them the optimum beginning, and that's what our book is all about, is to say, these are the signs, this is what's happening, this is why it's so important to know these things in those first 2 years of life.
And then just the last piece I want to touch on a little bit is the birth process. We live in Boston, and we have one of the highest C-section rates in the country, and people are starting to get used to C-sections being normal ways to deliver babies. And they don't think about the trauma that occurs not only to the mom, of course, but also the baby as they're pulled out of the womb without going down the birth canal, getting through that pumping mechanism, getting that transition, getting that cranial molding, getting basically that pump prime, and getting yanked out of the mother, and stretching of the spinal cord and dura. So when you start to look at what normal birth processes are, there's so much intervention in the birth process these days that is the starting point often where these traumas occur to the nervous system, to the cranium. I mean, we're talking about a baby. I'm just going to kind of hold my little skull up here. I'm just talking about a little baby here that has a skull with all these soft spots and all these sutures and fontanelles. It is very vulnerable to abnormal pressures. So it's really important that when we think of things that are common. We also understand that there is trauma that occurs not only in utero, but during the birth process. And when parents start to see those abnormalities, they need to have somebody who can help look at it and tell them if this is an issue or not an issue.
100%. And I would even say like the in utero positioning can impact that baby's skull and spinal alignment, right? So we'll see babies that are stuck in a breech position the last several weeks of the pregnancy are going to have more dural tension and cranial distortions. I see it definitely with multiples as well. There's crowding in utero. And I mean, sometimes they come out with really massive cranial distortion right out of the womb, as opposed to the average baby, it's like 2 or 3 months that shows up from a torticollis, right, position.
Or even look at preemies when they come out and their skull is actually softer because they came out early before it has ossified. So now you have a softer skull that's being compressed. I don't know if it was you or someone else I talked to last year, and I thought it was really brilliant. We talk about primal reflex, baby holding their head up, sitting, walking. She said to her, the first primal reflex is the ability of the baby to turn head down in the uterus. Yes. Actually, that's a primal reflex. And if that isn't happening, you already found that there's a glitch either in that system or maybe some kind of pelvic constraint issue. But I thought that was brilliant, because that's the first primal reflex that occurs in utero, is the baby's ability to be able to go head down in that gravitational stress, to basically know intuitively or neurologically what is the best way to exit the mom's uterus.
I mean, you even see with the birth video how the baby is just turning their head and shoulders during the labor process, right? I mean, those all have to be reflex oriented. People think that the mom is doing all the work to push that baby out, but it's a team approach, right?
Partnership, for sure. Absolutely. And it stays a partnership, so it's like when you look at forever.
Forever and ever.
It's so true. Yeah. I mean, it is true.
I find sometimes also when we get people who live a more natural lifestyle with their chiropractors, I think it was a great point that you made, that the birth didn't go exactly the way they wanted it. Maybe they hadn't did a C-section. Maybe something had a forceps, or something didn't happen, or they had an epidural and they want to do it naturally. And you just coined the perfect thing that I tell them, said it's not just a one-person deal. Yes. There are two beings doing this process. So it's not like you did it wrong or you didn't do it.
Or your body failed you.
Yeah, I failed to do this. I didn't do this right. There's a being that came onto this planet with certain lessons that they need to learn as well. And part of that starts during that whole, not only the birth, but during that conception, that whole building of the embryo to the fetus, to the baby. There's a process that's occurred in there that you have a part of, but they also have a part of, and that you have no control over that piece.
So I would actually, as we're speaking about a baby's neurological development, I'm wondering if we could even speak about that in utero experience for the baby, and for moms listening that are currently pregnant, if you have any recommendations of what they can do to help optimize baby's neural development even before the birth.
I think that's your thing. I never carried a baby.
Of course, being under regular chiropractic care.
We have to say it, Nancy. We have to say it.
We cannot assume that everyone knows that.
Yes. So can you talk about why that's so important?
Well, it's just the alignment. The pelvis and the alignment and your nervous system. And I see this all the time, actually, after the baby is born and a mother brings the baby in, but not herself in. It's like, you're still in a relationship. You share the nervous system, you share a blood supply, and you still do that. So it's really important that if a baby is, say, born a little dysregulated, that the mother also be under chiropractic care. As I say, of course, all through pregnancy, just because keeping the pelvis aligned, keeping the nervous system aligned will actually give the opportunity for the baby to be born. Of course, nutrition, all the other factors. But to me, as chiropractors, we have to look at the nervous system. It's the controlling factor.
You're seeing, like with the pregnant mom, her parasympathetic, sympathetic nervous system is more imbalanced with that regular chiropractic care. And therefore, her stress hormones, the cortisol, all those things are going to be less impactful on the baby, which they are receiving that in utero.
Of course.
And improved immune system function. And we all know the chiropractic care, given regular chiropractic care, how it improves the nervous system. The nervous system and the immune system are intimately related. So if you're talking about immune system issues, you talk about mom who come up with preeclampsia or diabetes during their pregnancy. A lot of that, often, if they're under regular chiropractic care, doing proper nutrition, maintaining at least a certain level where their stress hormones aren't pumping all the time, could prevent a lot of those type of issues from occurring. The other thing that I want to talk about a little bit is that medical interventions. We don't talk about that a lot, but, medicine treats pregnancy like a disease process, like no one's ever done it before. And I think, too many interventions, ultrasounds every week for no particular reason. We say ultrasounds are non-invasive. Well, they are. They do something. They are forced. They're ultrasonic waves. So, be careful about the interventions. If they're necessary, absolutely. If you're looking at issues, but just to do it every week, just to check or to be careful. And the last thing that I find, which is really disheartening, is that pediatricians often rush moms into giving birth. Well, they'll say, if you didn't give birth on the day after you're due, then we're going to induce you.
You mean the OBs?
Yeah.
But all of that is based on disempowering the mother too.
It is disempowering. And there's a lot of fear mongering there as well, right? And I do see that. They're like, oh, you're a small woman. Your baby's very large. If we don't induce you, then you're going to not be able to vaginally deliver this baby.
I think the number one thing, I had delivered 2 babies. The number one thing that I would recommend is building confidence that your body knows what is best. That you know what is best, and that your body will respond and be able to deliver the baby in the best way. So all the messaging that you're too old or you're too fat or you're too
too small.
Everything. It doesn't make sense. It's like we're not all the same, but we all have gone through this process of the populations increasing. So I really feel like giving the message to the mother that she is in charge, that she can do this and build confidence and not based on a fear model. That would be what I would highly recommend. That would actually help the whole process and also build her confidence that she can take care of the baby when the baby's born. We disempower the mothers and then the baby is born, and we see it all the time. It's like there's this fear of like, am I doing it right? If the baby cries, is that too much crying? Or how much should I feed it? Or should I breastfeed? All of these are based on doubting yourself. And that mother's sense of like what is knowing what's right, we're losing that as a culture as we allow other people to impose their beliefs on us. So I think that's an important piece.
Well said, Nancy.
Yeah, and just on a neurological, as you touched on, Laura, is that cortisol levels. These people come into the pregnancy. You come in, you're 35 years old, you're pregnant, and the first thing they tell you is you have a geriatric pregnancy.
I know, it's horrific.
Oh my God, that's horrific. And so you're starting out with this fear, and you have to do the ultrasound, we have to check blood supply, and we have to check your blood all the time. We have, we're monitoring. And the mom, those create, even if they're small levels, every time someone has to take a test, whatever that test is, there's a fear around it. Because if it's a medical test, you don't want it to become positive. And if it's, an academic test, you want to do well. So there's always a cortisol. So if you go through your whole pregnancy and every trimester, they pile on more and more tests, you're creating more and more cortisol responses, and you're increasing the propensity for the labor and the delivery to be more difficult, because now you're adding, and the baby's feeling those cortisol, that goes into your bloodstream.
And then the difficult part is that you've gone through all the stress, and say you end up with a medical intervention for your birth, the baby is still there. You still have to take care of that baby. So you're not feeling well. You actually need time to heal. And yet there's a being that's 100% dependent on you. And so having the information of what to look for and is your baby growing the way it should be, I think it will help ease some of that stress. Parents are so afraid of doing it wrong. Like we see it all the time in our practice. A mother comes in, the baby's crying all the time, and they just feel like they failed. And they go, this is so much harder than I thought. And I said, boy, this is just the first 3 months. You have a long road to go. And so I think that when the baby is born in a state of stress and the mother's in stress, doesn't have time to heal, that it's really important to have the information of what's normal, what to look for, to have the confidence that you can take care of this baby. So I think in our area with
and where to look for support.
Where to look for support is a big part. I want to say something a little bit about that. In our area, there's so many postpartum options, from people to evaluate like your latch, people to evaluate the tongue tie, all of these things, and they only have a teeny window into the whole function of that being. So if you go to one, and we had this person, I went to a nutritionist and she changed her diet. She went to a dentist and they did a tongue tie. And so now the baby is 4 months old and has already had all this intervention, and is still, the parents really haven't adapted to being with the baby. So I think also having confidence to know where to look for what you need, and not to overtreat the baby as well. So because we have a lot of information doesn't mean that we have to always have the interventions. We see a little bit of that in our area where there's so much support, but sometimes it's just a little teeny window they're giving it, only seeing it through their lens and not a bigger.
And also, don't forget, we have the internet and AI now. So you just put in a symptom and you get a list of things that your baby.
Dr. Google.
From every Dr. Google, and so you need to be careful about that, especially, like you said, especially when it's a first child. It's a new world. You have, it's a crapshoot. As you have more children, you get more used to it. It's the kind of thing where by the time the fourth child is there and they're screaming in the other room, "Mommy, Daddy, Mommy, Daddy," and they're sitting on the couch going, "If you can drag your leg in here, come on in. Otherwise, have your brother and sister drag you in because we're not getting off the couch." And the first child is like, "Were they breathing? I'm going to put a mirror in front of them." It's the vigilance. So people need support, but they also, and that's what I think, informed. And what I think is really the difference that you have to look at is you have to give support without judgment. People always talk, like in our class, we talk about flagiocephaly. In the book, we talk about flagiocephaly and people go about helmets and it's back and forth. You really need to give the parents information, but allow them to make the decision what they want to do with that and support them in it. So if I have a parent who decides to use a helmet, I don't cut them off from care. I say, that's your decision. It's great. But, I still need to see your child, once a week or once every 2 weeks to help facilitate normal development and growth, even when they're wearing a helmet. So you have to really not judge the parent for what the decision they want to make. Give them the information as you know it and allow them to make those choices and then support them in those choices. Because the underlying thing with chiropractors is that we know that chiropractic care, regardless of what happens outside, helps your nervous system adapt better, increases your threshold of adaptability. So whatever you're doing outside of that, you need that underlying strength in your nervous system, your immune system, regardless of what your other choices are.
So that's such a valid point. So if the baby has a flat head and the parents choose to do the helmet, that would not replace cranial work.
Absolutely not. No.
Because the helmet's not going to optimize nervous system function.
Exactly. It's an external factor to create a new compensation as opposed to an internal correction that reduces the need for the compensation.
Right. And I feel like the helmet's very aesthetic oriented. Like, okay, we don't want this flat head. We don't want the smaller eye and the ear but the work we're doing hands-on as craniopaths is addressing the reasoning for those patterns, and that is going to help the whole nervous system work better. And so, yes, the child will look better, but more importantly, their nervous system is going to work better, right? That is always the optimal result here.
That is the goal.
Our focus is function, we use structure as an indicator sometimes that has changed, but our focus is really structure. Even if you see somebody, an adult, and you're evaluating them, they have a short leg or one hip high or one shoulder high, you may not change that entire structure, but what you're going to do is optimize function. It's no difference as kids get older and they need braces. My world, I divide it up into aesthetic dentists and functional dentists, which are people who know that when they're putting braces and changing the bite, that they're making a global change in the temporomandibular joint, the spine, the cranium, and everything. So therefore, what you want to be able to do is make sure that you're really optimizing function and not just, as you said, the aesthetic structure.
Yeah. Yeah, we'll see people for example, a teenager with a scoliosis. They're at that point. I'm not gonna reverse their scoliosis, right? They've gone through puberty; it's there, but we can help their function and help how they feel, and even how the nerves are working with their intestines, for example, if that's where the curve of the scoliosis is largest.
Absolutely.
So, yeah.
It's all about adaptation.
Right.
And that's really what it's about. It's resiliency. And a little bit about the, putting helmets on or adjusting for looks. It's very important not to get caught up in that loop because none of us are symmetrical.
Right. Nature is not symmetrical.
Exactly. Right. So parents, it's important to know the difference about what needs to be done, and what can be done and what can't be changed, and the acceptance of that. I do think a lot of healing does happen with acceptance, but I'm all for being informed. I think an informed parent makes better choices. And also there's less guilt, And I also think judgment causes a sympathetic response. So it's our job to inform them as best as we can and then let them have their experience without judgment.
And the thing that I always think is really important, and the reason we wrote this book also is because we know as chiropractors, we have a limited time with our patients, and they tend to ask a lot of questions sometimes. And this book is a way that chiropractors, especially those who do cranial adjusting, can help. Look, this is what I tried to explain to you a little bit about the neuromeningeal system and how that's affecting the tension on the bones and the nervous system and the bone growth. But here, why don't you take this book? A lot of our people who buy the book give it to patients. Take this book, and this gives you a lot more information about why we do what we do. So it was also to facilitate the educational process when it comes to patients, so that we're not spending, a half hour every time trying to explain something to them, and after 4 minutes, they're not listening anyhow. So let them take the book home, and they could understand, have a better idea about it. And then they might actually ask. What we usually do in our practice is I'll say, look, if you have any questions, send me an email, because I don't want to take the time in the office a lot of times. So I want to, I'll have them send me an email to ask questions about it. But that's the other reason we wrote the book, is to help you, move your patients to the next level of understanding about what we do.
Yeah, this book is written for practitioners, but also for parents. And the checklist, I think, really is very parent focused. So can you speak a little bit more about what's on the checklist and how that could help a parent that has a child, for example, who's under the age of 2?
So let's just take what we talk about, two chapters. Let's talk about the chapter called The Structures Beneath. So we talk about the neuromeningeal system. We talk about how it affects growth patterns in the brain. So in the back of the checklist, it'll tell you what signs to look for if there's too much tension in the neuromeningeal system. Like maybe you look at a baby that always extends back. They're never comfortable doing tummy time. They have trouble nursing on one side. They like to nurse on one side more than the other. So those are some factors that are telling there's too much tension in their nervous system, and they're compensating for it. So in that book, that chapter, it explains the neuromeningeal system, but it gives you a number of other things, of hit lists to look for, checklist to look for. The other one is there's one chapter called What's Wrong with His Face. So when you look at a kid, and like you just mentioned, and Nancy just mentioned, we're not perfectly symmetrical. But when you see a gross asymmetry and underneath that asymmetry, so let's say you see one orbit slightly smaller than the other. Okay, that may be an issue, may not, but then you watch the child track and one eye doesn't move as far in one direction as the other, or they have a chronic head tilt, or their jaw deviates to one side. Those are all signs that asymmetry is causing functional compensations. So those are the kind of things that are in the checkbook. So your child, again, the jaw deviates one side, the eyes don't track all the way, they can't turn their head all the way equally, and you're seeing these distortions. That is a sign that distortion may be something that needs to be addressed because it's an underlying compensatory issue. And we've done that for pretty much every chapter that has either neurology in it, so primal reflexes, same deal. If your child's missing developmental milestones or primal reflexes, if you see your child startle all the time and they're now 8 months old, that is a motor reflex that should have been gone before that period of time. If your child can't grasp or they have head lag, all those things are laid out so they can know, wow, my child can't lift their head. Or when I give them my hand to grasp, they only grasp with the right hand. Those are all signs of issues. So those are all checklisted off as well if this is happening. So we try to do that with every single chapter. Of course, some of it's repetitive, because some of the signs are similar for different things, but at least it gives you a window to know that just because you're looking at something doesn't mean it's wrong, unless you can also put these other boxes checked off to show that there is a functional issue as well.
Right. And I believe the first time we spoke, we were talking about how the CDC had recently changed the milestone. So I'm sure you also, that's covered in the second edition.
It is absolutely covered in
Yes.
the book. Yes, absolutely.
It is covered in the book.
Yeah, I can't get started on that. Nancy stops me on that one.
Yeah, well,
You got the elbow.
Yeah, I get the elbow on that one. Don't go up on that one.
But milestones in development, how we develop, are pre-programmed, and the CDC can decide to eliminate something because it's not happening. But that's what we talk about. Just because it's common doesn't mean it's normal. And so certainly going through the developmental milestones and reaching them at a certain age or within a certain span of age is what's normal. And we definitely go over that in the book and discuss that. So it's not for, again, not for something like CDC or anybody else to tell us what is normal in the nervous system.
Well, my analogy for that, since we did mention it just a little, my analogy for that is, we watch the Olympics, a lot of us do, and we watch them every year, and you see records breaking all the time, right? People get swimming faster, running faster, skiing faster. Well, if you watch the Olympics and every year people did worse,
did less.
Did less. We not only would it would say that human potential is being decreased, right? Oh, so now no one can run a 4-minute mile. They can't run an under 10-second 100-yard dash. If we saw that, we'd be concerned. So to think that because your kids are no longer reaching the milestones, instead of being worried about that, let's just drop the milestones.
Yeah, move the bell curve to fit the common.
We wouldn't do that in any other aspect of our lives, when we're talking about human potential. So who gives them the right to do something like that instead of trying to figure out why our kids are getting to the point where they're not able to reach milestones that have been developed for decades?
And the truth is that whole conversation with the CDC was part of the reason why we wrote the first edition, was because we saw it. Not only was the CDC responding to these aberrant neurological things that were happening, and they were around us all the time, with babies not being able to lay on their tummies, babies not crawling, all these things.
Not turning over.
And not turning over, not sitting up, or going from lying down to walking. All these things are not normal, but they became so common. And we saw the industry, whether it be the toy industry and the doll industry, following the distortions. We'd go into the toy store and would see dolls that had cranial distortions. This is an example of how we normalize dysfunction. So that's part of the reason why I know as a new parent, I can remember, like, I loved my checklist. I loved, looking at my child's development, making sure that they were hitting the milestones within the normal time period. I was definitely aware of that. So I'm the kind of person, I'm the kind of mom that would have liked this book. And I also would say that it's not just moms, it's grandmothers. We give these books to the grandparents. Number one, they have time to read. Mothers don't have time. Parents don't have time. Grandmothers have time. And they're the ones that will actually facilitate oftentimes the care for their grandchildren. So
they're often taking care of the grandchildren.
They're often taking care of them.
Take care of them. They notice things that they've had kids, and they'll all of a sudden notice it and try to talk to their child about it. They tend to get a lot of kickback. And if they can just say, look, this is what I noticed with Johnny. I'm not telling you there's anything wrong, but I noticed this. I'm a little concerned. This is what I saw, and here's the book to do that.
Yeah, they haven't gone through the tiring process of giving birth and staying up all night and doing all the things that the parents go through. The grandmothers can have, or grandparents can have, a little more objectivity. So we think it's a great grandparent.
That's a really interesting point. And also, like, if their birth was, let's say, 30, 35 years ago, then the normal or common development for children 30 years ago was very different than what it is today, right? So they also had that comparison.
Right. Yeah.
And hopefully wisdom.
Yeah, the whole idea is to help facilitate change and to help make each generation slightly better, or at least as good as the generation before. That is not the trajectory that we're seeing. The generation born in the year 2000 was the first generation that's life expectancy isn't necessarily more than their parents. And I'm not saying we're going to live forever, but when we're talking about neurological function and adaptation, is we want stronger nervous systems, stronger immune systems. One of the HHS, Health and Human Services, said that 54% of kids in the United States have chronic illnesses. I'm sorry, that's not just something that you go, oh, so more than half the kids have chronic illnesses. That's okay. That's crazy stuff to be.
It's concerning.
And we just read numbers now. That's the other thing, online. We read numbers and go, so now 1 in 32 kids are on the autism spectrum. Well, when Nancy and I graduated chiropractic school, it was 1 in 2,500. That's a huge difference.
Here in New Jersey, 1 in 6 boys are on the spectrum. 1 in 6. Mind blowing. Like, there's absolutely nothing normal about that.
Right.
No, absolutely.
Our whole world's going to be ruled by Elon Musk in the gang. Not that he's bad. It's just different. But I'm just saying, it would be, you're right. It's 1 in 6. And so not only is it going to affect, the generation as far as functionality, but the amount of money that it costs when you have kids who need support. You're talking about kids who are in public schools who no longer could be in the public school situation, that they then need special care. That costs thousands and thousands of dollars. And if the parent can't afford it, often they go back to the town or the city to get money from them. And so you're talking about tens of billions of dollars that it's going to cost just to take these kids and allow them to function in society, even on a baseline level.
We all know that we are all invested in having our children be healthy.
Yeah.
So from all different levels.
Yeah, 100%. So we have to wrap up this podcast, but I want, if there's any last thoughts you want to share, and then certainly how can people find out more about your book?
Do you want to do that?
Well, I was just going to say, I just want to really appreciate you having us on and sharing this book. And also, as I said before, the way I looked at it before is we gave you information, but we didn't give you a way to facilitate using it. So we think the second edition does that. You can find It's All in the Head. We're the authors, Dr. Martin Rosen, Dr. Nancy Watson. It is on Amazon. You can also get it from our website, which is drmartinrosen.com.
And it's Dr. Martin Rosen.
Yeah, we do offer, selling it in bulk for those people that want to have it in their waiting rooms or to give it out to their clients. We're here to support you in learning this material and facilitating the health of...
And for those of you who are chiropractors, if you go on that site, you'll also see all the courses that we offer. And we also offer one of the courses based on this, All in the Head, to lay people as well. That's going to be on our that's on our website as well. One of our patients and mothers is actually doing that course for parents.
Oh, I love that.
Yeah, so we hope to have that done. If not by the fall, the beginning of next year, we'll actually have a whole program for mothers or parents based on this book. Yeah. So, it will be.
Keep in contact with us.
Keep in contact. Reach out to us. Join our mailing list, and we'll be happy to keep you informed of all the things we do. And thank you for all that you do too, Laura.
Yeah, thank you, Laura. It's great to see you. And we do. We appreciate you having us back on again and listening to us. And I'm glad you got us both this time.
I know. This is fun. This is a fun conversation. It was great.
And I like the other perspective. Sometimes I might miss the female perspective, I've been told on occasion.
Well, you have never given birth.
That's right.
Thank you.
Thank you. Well, I hope you enjoyed today's episode with the amazing Dr. Rosen and Dr. Watson. I had such a great time speaking with both of them and really soaking up all of their wisdom, passion, and knowledge for really helping to create and raise the next generation of children, and how we can do that through a healthy lifestyle and supported with chiropractic care and cranial work specifically to help those little brains grow and develop the way they are intended to. So I highly recommend checking out their book that just came out, the second edition. It's called It's All in the Head, and you can find it on their website, drmartinrosen.com. You can also get it on Amazon. And this is a great way to really empower you as a parent to understand if there is something that may be off, especially if your maternal intuition is telling you something may be off with your child and it's getting dismissed by your pediatrician or others in the community. This is going to help give you some confidence that there is something that can be corrected and addressed, and ideally done that first 2 years of a child's life, so that it is easier to manage and address at that point before it becomes set in as a pattern that makes it harder to modify. So they have that checklist at the end of each chapter in their book, and It's All in the Head, to help you as the parent really understand what's normal versus what's common. And we want our children to have that normal, optimal neurological development.